The U.S. Supreme Court just concluded 3 days of arguments to determine the fate of the Affordable Care Act and whether the U.S. government can actually require Americans to buy insurance. President Obama has praised the Cleveland Clinic and Mayo Clinic as model hospitals for the way he would like to see health care provided in this country. Joining us now is Toby Cosgrove. He's the president and CEO of the Cleveland Clinic and joins us live. Welcome to In Business. Are you planning for contingencies here if healthcare reform is repealed?
Well, what we think is going to happen is not going to, and the Supreme Court will not change very much what we have to do. You have to understand that the American healthcare system right now is very fragmented. The quality of the product is very different in various portions of the country, and the costs are too high. And we have to address those things, and we've already started working on those things a number of years ago. And we're putting things in place which really won't change very much regardless of what happens at the Supreme Court.
Well, when you talk to some of your other colleagues in the business, so to speak, what do they say about whether they want to keep parts of this law?
Well, I think there's a variety of opinions. A lot of CEOs of hospitals and colleagues are saying that they're going to wait and decide what the Supreme Court decision is. I don't think that we can do that. I think we need to address the things that I spoke about, and the ways that we need to address them is we have to improve quality, we've got to take costs down, and we have to have a more integrated system. And the ways that we're going to do that is we have to have more efficiency in the hospital delivery system. We have to change the way that we incent people, particularly doctors and patients, about the sort of responsibilities that they have in healthcare. And patients have got to learn more about taking care of themselves so we reduce the burden of disease through wellness. And the doctors are going to have to change to just fee-for-service to providing value for the healthcare dollar.
But if the government can't mandate that, how do you initiate that change?
Well, I think all of us realize that we have to do this. We number one in all of our minds is quality, and we're putting a major push on in terms of improving the quality and the experience that patients have within their hospitals. And we've seen huge jumps in that in our own institution over the last 4 or 5 years, as we have really gotten the IT in place so we know exactly what's going on and we can keep track of the figures. In fact, over the last decade, we've invested $1 billion in IT and $300 million in electronic medical record. That gives us the ability to understand exactly what's going on and keep track of it.
Well, and the profit margins within healthcare are pretty impressive when you look at it from an investment standpoint, but that hasn't meant a good thing for the consumer in terms of the affordability.
Well,
what will actually change in the next 5 years if this law isn't in place?
Well, what we know right now is the average margin for a hospital is about 2.5% across the country. Some hospitals doing significantly better, quite a few hospitals running in the red. And I think what you're going to see is as hospitals are going to be under pressure to reduce the prices, that's coming both the insurance and from the government. You have to remember right now that 50% of the hospital costs are paid for by the federal government, and they are reducing their payments to us on a regular basis each year. So we know that's going to go down. So we have to become more efficient and take costs out. And we've done that in a number of ways across our organization. We've done it from integrating our services and becoming more efficient with our services. We've done it by our purchasing. We've done it by using the IT. We've done it by having teamwork with our organization. We've done it by changing our method of delivering care. We're doing more group sessions now to allow multiple people to be seen at the same time. We've increased our access. All of these, and we've even taken down our energy costs. All of those things are major factors in trying to become more cost-effective.
Well, we'll see if some of your colleagues can follow suit on that. Thank you very much, Toby Cosgrove.
My pleasure.
For giving us your assessment, CEO there of the Cleveland Clinic.